Hello, everyone. A very good evening and a very warm welcome to our Facebook Live session and YouTube Live. Today, we have kept this session specially as a question answer session. So, whatever questions the parents had, they asked us through the Google link that we had shared, and we are going to try and answer some of the frequently asked questions today. And we'll just go through the questions and then keep on answering them. And for more questions, you can go on to the link and post your questions so that we can take your questions regularly for our future sessions. So, I am Dr. Himani. I am a developmental behavioral pediatrician, and today I'll be answering the most commonly asked questions by the parents on this forum. Let's begin. So, this first question is by Prerna, and she's asking that my son is 11 months old. He sometimes does not respond to his name when I call. Should I be worried? So, not responding to name does not necessarily mean autism. On an average, children start responding to the name by the age of 8 to 9 months or by their first birthday. And all these children, they will start by first birthday, all the children will start responding to their name call. Now, not responding to the name can mean a number of things, such as a hearing loss, probable autism, or any kind of a developmental delay. If your child has not started responding to name by this age, you must visit a developmental pediatrician and report your concern. At the same time, as the parent should also look for other signs of autism, such as lack of eye contact, not pointing to items, or performing any kind of repetitive task like hand flapping, rocking. Sometimes children, they are sitting and playing, they will be rocking. They can also look for absence of typical development, like the child will not be able to show interest in the family members, or will not typically show too much of an emotional reciprocal behavior like playing with the parent or responding to the social cues. Those kinds of signs, if you observe, then you must reach out to a developmental pediatrician. Next question. So, our next question is from Archana and Kunal. Archana is asking, my elder son was diagnosed with autism at 3.5 years of age, and our younger son is going to turn 2 in another couple of months. When should I be worried? So, similar question was asked by another mother who said that my son was diagnosed with autism at 4 years of age, and now I am pregnant. Will my next child also be autistic? So, while having a child with autism does not raise the risk of having a, another child with the same kind of a disease. So, once if you have the first child on autism, then the chances of the second one is 15%. However, 85% chances are that the child can be neurotypical. So, boys, we must know, are at a much higher risk, 2 to 3 times more likely at risk as compared to the girls. And in case you notice any kind of loss of language skills, aloofness in your child, or the child is not interested in playing with other children of his age group, or the child is lacking eye contact, there's some kind of repetitive behavior in your younger son who's 2.5 years old, you should definitely visit either your pediatrician or take an advice from a developmental pediatrician. However, if you have not noticed any signs of autism in your younger child or son by now, then you must keep a close watch in on their development. And if the child is developing age appropriately by 2.5 years, then it is very unlikely for the child to have autism after 2.5 years. So you can be assured if your child is developing typically by 2.5 years, talking, speaking enough for his age, communicating, socializing. In that case, we do not really, the chance of having the child on second child on autism will be less, minimal. At the same time, it's also important to know that although sibling of autism child may not develop full blown spectrum of autism symptoms, but sometimes they can have mild subclinical traits of abnormal social behaviors, language deficits, or some kind of a sensory sensitivities. So it's important for you to understand that the child, the sibling, may not have full blown symptoms of autism, but may have some traits. Some of the siblings can have speech delays, some can have little abnormal social behaviors, or some sensory sensitivities. So we must always be on alert, and whenever we find any red flag, we must reach out to the developmental pediatrician or your pediatrician who's taking care of your child. Next question. So the next question is by Ayub Khan. He's asking, my child is 2.5 years old and is obsessed with certain routines such as sleeping on the same bed sheet, wearing the same shoe color, but he speaks in sentences and uses gestures to convey his need. Is he autistic? Should I visit a developmental pediatrician? So, while it is, we all know that repetitive behaviors and obsessions may be normal in young children. So, it's not always necessary that some repetitive behaviors or obsessions are all of them are abnormal. No. Some repetitive behaviors, some small obsessions can be normal in young children. They are typically expected to fade away with growing age. However, if these symptoms are persistent and continuously present, they would either indicate autism spectrum disorder or sometimes could be a part of attention deficit hyperactivity disorder or some kind of obsessive compulsive disorder. So, children with high functioning autism who are high functioning may speak sometimes in full sentences. They may use gestures, but they may have some deficits in social communication sphere. At the same time, you should look for other signs such as flapping of hands, rearranging of objects, or lining up of objects, repetitive behaviors. Uh, can be a cause of concern there. So it's best and thing to reach out to your developmental pediatrician, because one sole symptom cannot be diagnostic of autism spectrum. We have to have a gamut of symptoms across different domains, and then only those umbrella of symptoms, when they are present all together in a child, then only we diagnose as autism. So one single symptom can never be diagnostic. If you have a concern like that, must reach out to your developmental pediatrician. So let's take up our next question that is asked by Varsha. Hi, Varsha. Varsha has asked that her son is 3 years old. He had normal language and speech until 2.5 years of age. However, since last 3 months, after a bout of a fever, he has stopped speaking and does not respond when called. I visited the physician who told me not to get worried. I'm not convinced. What should I do? So that's a very interesting question, Varsha, and a very valid concern also by you. So here I would say that regression or loss of already developed language and social skills in a toddler is always worrisome. So your worry is right there, and it is correct. And one should never take it lightly. The condition is also known as autism with regression. So there can be a regressive type of autism. Usually, the loss of these skills occurs sometimes between 15 to 30 months of age. Your child should be evaluated for a possible autistic regression by the pediatrician or a developmental pediatrician or somebody who specializes in diagnosing autism spectrum disorder. And it's also very important to get a test for hearing loss, so to rule out hearing loss, since there are some kind of brain infections which can lead to hearing loss. So if the child has had that kind of a fever, high grade fever, it was not well, so then there we need to think of ruling out hearing impairment, which could have happened secondary to some kind of a brain infection. So here you must seek out the guidance of a expert to help you with the correct diagnosis. Coming to the next question. So the next question is by Richa. She's asking, what should I do if my child starts showing some of the signs of autism? So, Richa, autism spectrum disorder expresses itself in toddlerhood. So, in the early years, when the child is a toddler, between 1 to 3 years of age, typically, and it can cause delays in certain basic areas such as speech and language and some gestural communication, along with difficulty relating with people in the immediate vicinity and surrounding. Now, if your child is showing some signs of autism, some kind of red flags, not socializing enough, not being able to communicate, not using language, you must seek for early diagnosis, as we all know that early and intensive intervention can be started if we get an early diagnosis. And important thing for you to know here is, do not lose hope. Early behavioral intervention can reduce the disorder effect and can also significantly reduce its severity. So it's very important for us to support the child, diagnose them early through a proper development assessment, followed by a timely and early intervention. So next question is by Nimish Raj. Nimish Raj is asking, I have heard that certain vaccines can cause autism. Is it true? Are vaccines responsible for autism? So, a lot of time we come across similar questions by many parents asking or having doubts about their child getting autism after a certain vaccination. So, it's very important that we have a clarity that the role of vaccines was speculated in the causation of autism long back, and then a considerable research was later done, and they found that these were mere speculations and not the truth. Hence it has now been concluded, with the amount of research evidence that we have in today's times, that there is no role of vaccines in the causation of autism. So vaccines prevent some of the common childhood illnesses, and especially those illnesses whose effect per se is very very devastating, and there are very devastating consequences on a child's health. So vaccination is extremely important, and there is no scope of not giving your child those vaccinations, because they are life saving, and most of them are preventing your child from getting exposed to some of the very devastating and dangerous consequences of the diseases which are prevented through these vaccinations. Not vaccinating your child or delaying the vaccination can be extremely risky, and it will not prevent your child then from vaccine preventable diseases, especially diseases like measles, which still exist, and it is one of the leading cause of sickness and death in children currently also. So it's very important that we get our children vaccinated and we follow the guidelines, because there's a lot of research which has been done to and then the guidelines had been written, and which said that there is absolutely no role of vaccination in the causation of autism. Let's head to our next question, which is by Mithun. Mithun is asking, my son has recently been diagnosed with autism. Can he suffer from any other medical condition? So that's a very correct question, and a very relevant question to ask, that if you have a child who's been recently diagnosed with autism spectrum disorder, it's important for us to understand that what are the other medical comorbidities which can be there and which we may need to be aware about. So, children who have autism can have a range of medical concerns such as constipation, diarrhea, abdominal pain, that is, uska matlab hai stomach pain, or reflux of the GI fluids, and their sleep can be disruptive. They can have reduced appetite. They may have very restricted food habits, food choices. They may be eating non-edible stuff like mud और जो walls के ऊपर पेंट होता है वो उतार के खाना जिसको हम पाइका कहते हैं. Then they can have mood disorders along. They can have headaches, food allergies. Sometimes they are very, very anxious. So anxiety is a very common co-existing medical condition. And in very few children, seizures can also occur. So we need to be aware of these other medical conditions which may be present and which need to be treated on time, because um, as a parent, we must keep a detailed note of the child's health and concerns and must report them to his or her doctor on right time. So let's go on to the next question, which is asked by Ira. Ira is asking, is autism a mental disorder? Is my child going to be mocked as mental? Yeah, that's a very relevant worry that parent can have, because of which lot of times parents, they shy away from disclosing diagnosis to the relatives or probably to the close friends or family, because they feel that my child shouldn't be mocked or shouldn't be bullied as mental. So, autism spectrum disorder, now we need to understand, is a group of neurodevelopmental disorders that are neurological in origin, and it can cause some social, language, and communication delays. In these areas, there can be some amount of delay. So it's very it is extremely wrong if we call it as a mental disorder. A lot of children on autism spectrum can be intellectually high, or they can have average intellectual abilities. Some of them can have little below average or delayed intellectual abilities, but it is a neurodevelopmental disorder. So that using a term like mental disorder is not appropriate and correct when we look at children with autism spectrum. So next question is by Priyanka. So Priyanka is asking, I have heard about sensory integration therapy. Is it helpful in children with autism? Priyanka, it is believed that children with autism can have a lot of difficulties in their sensory abilities, like difficulties with sensory interactions, appropriate reception, then assimilation of the sensory input, and modulation of various senses. So, reception means whatever we are receiving from our various five senses that we know of. That information is then assimilated by our brain, and it is modulated, uh, and then we use that's how we use this information, assimilate, modulate, and we use it for our learning and day-to-day activities. So there is a significant amount of difficulty in this process in children on autism, and it can create behavioral impairments also in children with autism. So children who have sensory difficulties, or they can also present with more behavioral problems. So a well trained, well experienced therapist who is trained to do sensory integration therapy can help children on autism in their early years and in early intervention. So you have rightly heard about the therapy, and it can be useful. So our next question is by Raj. Raj is asking, what should I, as a parent, be aware of while caring for my child with autism? Can autism be cured with medication? So, Raj, as a parent, you must remember that autism is a condition and not a disease. Children with autism do show some deviances in their development from other typically developing children. So, uh, focus on the normal development that the child has already achieved. Let us focus on the good things that are happening. help the child to develop further, one step at a time, step by step. Each step may take time in a child on autism, but once an improvement is seen, it usually continues. So, working with a child is extremely important. Ensure that you get proper and genuine, appropriate professional assistance for your child. Do not fall prey to quackery. Reach out for trained, experienced professionals. And autism is not a disease, so it is not to be cured. Core elements in autism are mostly social communication, delays, and challenges with social interaction and repetitive restricted interests. So, these cannot be reversed with medication. So, there's no as such medication available which will completely reverse it. But medications can help and control the comorbidities and consequences of autism, such as if a child is very anxious, then you can use some medications to reduce the anxiety. If a child is very hyperactive, then you can give some medications to reduce the hyperactivity. But typically, we can only control and reduce the consequences of the comorbidities. Do not have any single medication to treat the condition. Let's move on to our next question, which is by Kanha. Kanha is asking, my son is 3 years old, diagnosed with autism. He's getting occupational therapy. He's not giving attention to his speech delay and has speech delay also. What should I do? So it's important to understand that there is no autism specific intervention per se. Since intervention is not one specific condition, we if we would have one particular challenge, we could have done one intervention and uh, treated it. But children who are considered to have autism have very specific delays and deviances in various domains, as we have discussed, in social domains and communication domains of development. So intervention has to be targeted at getting these delays and these deviances better. So we have to focus our intervention on social interaction, focus our intervention on building communication skills, and these interventions must begin early as we find a challenge. It should begin as soon as the parents are suspecting any speech delay or any deviance in the development. We need not at times even wait for a formal diagnosis, but the moment we identify delays, we need to start working with the help of intervention that will help our child build the skills. For these, there are different kinds of interventions, treatment modules, scientifically proven treatment interventions. So anything that is helping our child to reach or build certain set of skills is a good treatment, a good intervention. And we need to keep tracking the development and progress of a child to be able to know that this intervention is helping our child. So that's how. So next question is by Kittu. Kittu is asking, hi, my child is 2 years old, diagnosed with autism spectrum disorder and ADHD. He's getting OT and speech, and he does some abnormal behavior like head banging, and when told to stop, he resists. So how to teach him to stop doing that? So first thing is, OT here means occupational therapy and speech therapy. And he's doing some kind of abnormal behavior like banging his head. So hyperactivity in a child on autism and certain repetitive behaviors are very often consequence of irritability. Head banging is also one of the behavior which could be as a consequence of irritability, of not being able to participate in the appropriate way or satisfactory way, and not being able to understand what the child wants to express, and not being able to communicate their need, and that's why leading to irritability and frustration, and sometimes that ends up into banging the head. So this impairment or inability in their behavior, communication, social skills, all these can lead to some kind of a challenge, and they feel frustrated because of not being able to communicate, and end up banging their head. So, how can we stop? We try and find out what are the timings when the head banging is increasing. What is the antecedent factor? What are the prerequisites, or what are the timings of the day? What are the events happening before the child starts banging his head? And then once the child starts banging, what is the kind of response that he gets from the parents or the caregiver? Are they quickly running over to him, hugging him, kissing him, giving him a tight hug, and all the attention that the child wants? Or is the child having some medical problem like a toothache, or his teeth are erupting, or he's severely constipated? Because that can also sometimes trigger headaches, and headaches can lead to head banging. So we need to look at all the domains for the child, and then figure out what is happening, what are the timings of the day, events happening before the headbanging starts, how often is it happening, and how are we managing. Then changing the antecedent, or the events happening before headbanging, and changing the consequences, we will be able to reduce the episodes of headbanging for the child. So that is how we need to work at a certain behavior. Now, coming to the next question. So, we have a long question here, and the question says, is by Paril. Hi, Paril. My child is 5 years, 2 months, diagnosed with autism spectrum disorder, taking occupational therapy, speech therapy, and ABA for 5 months. Responding by improved behavior, self help skills, speech vocabulary has increased, betterment in sensory issue. But his IBAC and early year foundation skill assessment shows increased severity and low social emotional reciprocity, increased restrictive repetitive behaviors. Please guide what treatment strategy to follow, uh, which is showing visible improvement, or one which is showing hidden severity. I am a medico parent posted in a small city. Already, COVID has taken away the precious time of early intervention, so need guidance to afford appropriate treatment in my available resources. Okay, Parul, that's an extremely important concern and a challenge that you are facing and fighting through it. Living in a place where you do not have appropriate assistance can in itself be a very big challenge. However, it's important for us to understand two things here. One is that the child is 5 years, 2 months. While we are doing the intervention, the child is also growing chronologically in their age. So, whenever we use an assessment toolkit, which is measuring the developmental outcome of a child, or which is able to tell us what is the developmental age of a child, it is according to their chronological age. And if the child is improving, the skill set is getting better, the child is improving from his previous level. So, a series of assessment is required. One, to be able to really tell us, is the developmental gap or reducing for the child or not. And as the child's age increases, their developmental goals or items which they are expected to perform also increases in number. So at times the assessment can show an increased gap or a delay. However, if the child is learning new set of skills, is becoming more and more showing improvement in their social interaction, communication interaction, then I think you shouldn't be so worried. You must look at what new skills are added to the child. The pace of improvement sometimes can be really slow. It may not match up with the pace at which the child is growing age wise developmentally. So it's important to also focus on the good things that he has improved typically in all domains of development. And now teaching him on a regular basis can really help build his skill set in all these developmental domains. So, we also should understand that whatever interventions we are doing are expected to deliver some outcomes. So, whatever interventions you do have somewhere improved the outcome, so they have worked for the child. But what you can do in addition to that, have a written diagnosis, plan, and outcome of whatever intervention you are doing from the people who are giving the intervention, and then have some goals, subjective, objective, whatever ways. You have to have some goals which are planned, and when are the outcomes expected, or how much can be the outcome, how are we going to measure it. uh, that is something that we look at whether a child took 1 month to achieve uh, 5 out of 10 times name call response. We were trying, the child is not responding to the name call. Now we started intervention, but after 1 or 2 months of intervention, the child has started responding to name call 7 to 8 times out of 10 times that we call him. So that's an improvement. That's a significant improvement. So we need to make a note of all those possible improvements that can come, and then uh, objectively record the improvements, and then look at the change. So don't just go by that the child is increasing in age. Obviously the developmental skill set which a developmental tool will pick up will be much higher. So it may depict increased severity according to their current age. But if the child is improving, then you must continue to work with your child. Don't get worried, don't stop intervention, don't get disheartened with your efforts, because the child has shown improvement in all domains practically. So that is what I would. And keep training yourself. You're a professional, and you're in a remote area. Keep training yourself, learning new set of therapies, skills, methods. Keep applying them. If you want to, in today's time, you can seek online support from trained therapists. You can reach out to us. We can provide you online support with our therapists for your child. So Paril has another extension of the question, which is also saying, what is important in tracking autism treatment response of a child, visible behavior of a child, or report of assessor? As we seek treatment for symptoms of child, what improves on therapy by IBAC assessment of the child after ABA therapy planned by neuropediatrician and child psychologist, showing increased severity in terms of increased restricted repetitive behavior and reduced social emotional communication. So again here, Paril, it is important that when we are looking at assessing a child who's 4 years old, their social demands are less. They are probably more confined to their houses by 3.5 years. But the moment they start stepping out, start going to school, start going to play areas, their social demands are increasing. So the stress also is increasing for them, while their skill set is very gradually catching up. And that excess burden, or the excess increase in the social demands, leads to increased repetitive behaviors. And then it turns out that the severity is increasing, because the symptoms are now becoming more visible, which were not those prominently seen in the child. That is the reason why probably the scales or the assessments which were done showed an increase in the severity of the symptoms. However, it's important that the skill set is achieved. Whenever you are trying to mark the progress of a child, we must look at two domains. One is the skill set improving for the child. Is the child becoming gradually more and more independent in their social skills, in their communication skills, in their self help skills, in their physical acts? So, if that is happening, then we are progressing. We are definitely progressing. But because the social demand for that age group is also increasing, the child is becoming more anxious at times, more restless, leading to increased repetitive behaviors, and that is could be the factor leading to increase in the severity of the current symptoms. So just continue with your interventions, don't stop them, don't get disheartened, keep working, find out what is stressing up the child, and find out when the repetitive symptoms they are increasing, and then ABC, do it ABC for each and every symptom, and then work on those areas. It will help those symptoms to reduce. Second segment is always look for a medical cause. Has there been a change of house, has there been a change of place, or change of person taking change of teacher taking care of, or change of school happening, you have shifted your house, or is the child has had the child been sick, or not keeping well in last few months? So all those factors can impact, and if they are there beforehand, then they can impact the assessment which is happening. Assessment is typically evaluating the child at that particular point of time when you are doing the assessment. And if you take repeated evaluations, then a lot of times you have to take multiple factors into consideration and then figure out whether my child is improving or not. Well, I hope that our questions today were very, I think the parents have asked some really amazing and important questions. They have picked up some very important topics around autism spectrum, and I hope I have justified with my answers all the questions. If you have more queries, then you can click on the Google link that we have shared, and you can post your question there. And in our next and forthcoming sessions, we'll try and answer more and more of your questions. We'll club the common questions together and we'll answer your questions, and in whatever possible way that we can, we'll try to cover most of your questions through our sessions. I hope today's session was useful for you all, and it has helped you all. And we will see you again. I think it's already 40 minutes that we have been answering these questions. And all the parents who have joined in, thank you for joining in for our live session. We'll come again and cover all the questions which are asked in today's session also in our next session. So thank you so much. Have a very good evening and good night.